Take one. Let me spit out my gum. Shit. Oh my God. I have no idea where that landed. All right. What's up, guys? Welcome back to my YouTube channel. Before I get started with this video, I just want to say thank you so much because we are almost at 20,000 subscribers, which to me is absolutely insane. I graduated college in 2018 expecting to be a psychologist one day. That's what I wanted to do. I ended up going into sales, and in the back of my mind and on every single weekend that I had free, obviously as a salesperson, I worked really long hours. I didn't have the time to focus on making content. And in the back of my head, I always dreamed about vlogging, and every vacation that I would go to, I would make vlogs. I have a bunch of vlogs that since I have deleted off of YouTube. And to be here today, so many years later, like what, 5-6 years later, after graduating, and to now say that I'm about to hit monetization, which means maybe YouTube is going to start paying some of my bills, which would be a miracle. I mean, 20,000 people care about me and the things that I talk about is insane. So before I get any further with this, I just want to say to everyone who is watching me and my content, thank you so much. Like, I hope that you can truly feel the gratitude spill from the screen that you are watching this on. If you guys see, like, on my phone screen, I literally have YouTube plaques. Like, you can't see it. Maybe you can see it on my home screen, and my iPad screen are the same, but I have like these YouTube plaques. This is like my manifestation board. One of the episodes I want to do with you guys is like planning your digital manifestation board. You know, if I stay consistent, maybe I'll hit it. Either way, I'm still going to be recording, and I'm just happy to be talking with you guys because I feel like what's a better job than to be paid for talking? All right, guys, so we have a lot to cover in this episode today, but before anything else, I want to get started on my health update because last week I had probably one of the worst mental breakdowns that I have had in such a long time. I'm just going to start from the beginning. Whenever I was in LA, ever since I came off treatment and went into remission and then went back on to treatment, my medical care was not what it should have been. My doctors and my ID doctor and my surgeon never communicated. My surgeon wasn't sending my biopsies to the correct pathology teams. They were just doing like basic pathology tests. That's why we were never getting a confirmation or a positive. I was desperately searching for a different surgeon because the surgeon that I was basically stuck with was the one that made all those inappropriate comments about me scaring people and looking like I had monkeypox and never wearing a bikini again. And he also would argue with me so much about, you know, whether or not enough tissue was removed. I told him that there was not enough tissue removed. They ended up growing back. I still owe that guy like $5,000 and I don't want to pay it at all. By the way, thank you guys so much for the GoFundMe money. I've actually been using that to carefully fund my future treatments that I have so I can finally beat this thing once and for all. And knowing that I have that money there really helps me seek out better care, which I'm going to cover in this episode. So anyways, in Los Angeles, I felt like, you know, the longer I had been struggling with this whole Mycobacterium battle, that the less my doctors cared. Like, it was just taking too long for me to get cured. I was, you know, calling my doctor's office crying like, hey, like, why have I not heard back from my doctor? Like, I need to call back, you know, today. I would wait, you know, sometimes weeks, if not months, for responses from different people, searching for different surgeons. They had ridiculous wait times there because Florida has the highest number of Mycobacterium cases. Doctors and surgeons in Florida have more experience already with Mycobacterium. It's already hard enough as it is to find a doctor and a surgeon with experience in Mycobacterium. And the way that it works is usually there's, you know, a select few of doctors in each state that actually have true experience with Mycobacterium, and then the rest have just kind of like heard about it, okay? So I come to Florida. The insurance situation is very different here. I'm on an HMO plan now, which it can be a lot more difficult at times because you have to wait to see the PCP. And I was like, okay, well, I'm going to be saving about, you know, $300 a month with going on an HMO plan. So I decided to do the HMO instead. And it's like, I'm just a girl, okay? Like, I barely file my taxes correctly, and figuring out all this adulting stuff is like way over my head, but I'm doing my best, okay? I had a call with like some insurance person. They said I was on the right plan, and I was like, okay, great. The only hard part is waiting to go see my PCP. So I go and see my PCP. She tells me, yeah, I'm sorry about the Mycobacterium. Whatever referral you need, whatever appointment you need, just call our office. We'll put the referral in for you. We got you. PCP, she's great. Love her. They're super fast. I call them and I get referrals same day. So I'm not really having to deal with any issues on the PCP side. The issue is actually on the infectious disease doctor side. So I have been transferred over to the University of Miami, or so I thought. Basically, hospitals can't really turn down cases, right? Hospitals have to accept whoever comes to them. And so long as, like, obviously you're a network, and which University of Miami surgery and University of Miami infectious disease is within my insurance network. However, the doctors, infectious disease team wide, have wait lists so long that the earliest that I was going to be able to get in to even see an infectious disease doctor was in October. Then the earliest that I was going to be able to get seen for a surgery consultation was May 10th, which I said, okay, that's fine. If anything opens sooner with any other surgeon, let me know and I'll move my appointment up. So here's where we get to present day. They move up my appointment. They're like, yeah, we have something for April 22nd. If you can come in, you will have the consultation with the doctor. So I'm like, great. These are granulomas that need removed. Okay, guys, they're not like something insane. Like this is not like this high risk Mycobacterium flesh exposed eating, my skin open surgery. No. This is a controlled granuloma that my body has created around this Mycobacterium infection. What my body has been doing with these granulomas is really special and actually cool in a way, because I don't have just like Mycobacterium spread throughout my tissue and my flesh. They're localized in these balls. So if we cut around the tissue and if we cut around these balls, then we can properly excise as much Mycobacterium as possible, right? That's one of the nice things about my case, I have to say. And my most recent surgeon in Los Angeles, the derm surgeon who removed my one granuloma for testing, was also able to confirm that the reason why antibiotics was not working for me the second time around was because these granulomas, again, are so deep within my skin. The blood flow to the granulomas is already restricted and hard enough to get to as it is. So whenever the antibiotics don't have blood flow, they're not going to penetrate the area anyways, on top of the biofilm that this stubborn drug-resistant Mycobacterium creates. It's just too hard. The antibiotics are not doing anything against the Mycobacterium, essentially. Maybe it is doing something for residual Mycobacterium that's in my body pre-granuloma stage, okay? I hope that makes sense. Now, I'm explaining these things to my surgeon consult, okay? I'm not going to say his name, but honestly, it was not a good consultation. The guy was making this way more complicated and stressful than it needed to be. And I guess I shouldn't have gotten my hopes up, but he was the only surgeon that has an open calendar anyways, because he's new at the University of Miami. So I go there, I did a vlog, you guys can check it out. I basically am having like a mental break. I start the day out happy and then I end up turning into having a mental breakdown. So I sit down, I'm like all excited to talk to the surgeon and everything. I'm telling him about my history. He can, look on my chart, my history and everything as well. And then he's like, I'm not touching you until we get a CT scan. And I'm like, well, I just had a CT scan a couple months ago and it didn't show enough of what we needed to see. And he's like, okay, well, I'm going to order you new CT scans. I need you to get ultrasounds. I'm not operating on you until one of our derm personnel see you. And I'm not operating on you until you have an infectious disease doctor from University of Miami communicating with me on the case. And in my head, I'm like, okay, I like the teamwork approach. Like, that's nice. Like, I like that. That's great. But I'm like, the whole time I'm sobbing because I'm like, so what if that means that I can't get surgery to remove these painful granulomas until October, September? And his response is literally, then that's what it is. And I'm like, so you don't actually want to help me. Like, you're putting all these conditions on this very simple procedure for absolutely no, like, just to put me through more suffering, just to make this situation even more complicated. Like, even still, like, okay, if we want to do the CT scans and the ultrasounds and all that stuff, like, I get that, but remove the ones that are causing me issues now, at least. And then again, his entire thing was like, I've never operated on Mycobacterium before. I've never taken out these granulomas. I don't feel safe doing it. So I'm just like, okay, dude, if you don't feel safe doing it, then don't do it. You're clearly not the guy, because I've had consultations with other surgeons, mind you, that have been like, oh yeah, this is simple enough to do. We can do this. One of the surgeons that I had a consultation with, he was a derm surgeon. He was actually fellows with the surgeon who removed my last granuloma. He was like, I'll do it, but I'll do it one by one. The only problem is my insurance doesn't cover this guy, who, by the way, the consult went amazing with this guy. But I would have to pay out of pocket, and out of pocket, it's going to be like $1,200 to $1,500 per granuloma. I have like $25,000 left of the GoFundMe money, and I want to make sure that I'm using it really smart. If I have 7 granulomas that I need removed and each one is going to cost me $1,500, like it's not the smartest thing. And so I don't want to be cheap. I don't want to blow all the money on one thing, especially if more granulomas continue to pop up in the long run. And so my hope is that, maybe with this surgeon that I did like, I can pay out of pocket for a couple of procedures. And then maybe by that time I will find another surgeon that wouldn't mind operating on top of him. The problem is surgeons don't like operating on the same body. Like, if I've been with one surgeon, another surgeon is not going to come along and feel very comfortable or happy about the fact that, he's operating on someone that has already been touched. And I've already had 3 surgeons in my experience. And so that doesn't make any surgeon more eager to operate on me either. I know that this is really complicated and it's a lot of detail, but I get a lot of requests about my current health situation, and I just want to be honest about what's going on. So anyways, with this University of Miami surgeon who's, making this way more complicated than it needs to be and telling me that I have to do all these things and all these appointments, which, mind you, it's already exhausting enough and it already takes enough time out of my life for me to go to all these doctor's appointments. Frankly, I'm sick and tired of it. I could not have a full-time job if I wanted to. Thank God I have a part-time job that is very understanding of my condition. Otherwise, it would never work, right? Also, I think that there should be more part-time jobs available in the workplace for people in situations like mine, but that's a conversation for another time. Anyways, I'm crying in front of this doctor. I'm bawling. I'm frustrated that he does not care if all these appointments cannot happen until September or October. He's like, I'm just not going to touch you until I feel comfortable. And I even asked him, I was like, okay, so let's say that you get the CT scan and you get the ultrasound and you get the infectious disease doctor all on the same page. Would you still then at that point turn me away? And he's like, I have discretion to turn you away at any point in time. And I'm like, you're just an asshole. A lot of these doctors are assholes. And I feel bad for saying that because, again, like, I have had experiences with some great doctors, Dr. Mike, again, being one of them, who is also well aware of these things and well aware of like the poor bedside manner and the lack of empathy that a lot of these doctors have. But also, like, the surgeon that does want to help me that unfortunately my insurance does not accept, so it's like, I get it. And I was even on a phone call with one of the insurance people, and they were explaining like, it's hard because a lot of these doctors aren't getting paid appropriately from insurance. So they would rather just not accept the insurance and only go with the insurance companies that pay them properly. It's a big fucked up system. My entire point of this story is I went back home and I was so sad. My nervous system was so, I guess, ramped up from that shitty consultation with that surgeon that I just felt drained. I was exhausted. Crying makes me exhausted. I couldn't keep my eyes open. I didn't feel good. I really didn't feel good. I really didn't feel like myself. And that night, I ended up having the worst reaction to my medication. I was up until 4 a.m. puking my brains out. I had shivers and shakes, and I was just having the worst reaction. I thought I was dying. I'm puking so loud that I wake my roommate up. My roommate comes in. they're trying to reassure me like, hey, it's okay. It's just a bad reaction to the meds. Like, you had a long day. I'm just having like this full body response. And honestly, it's like this depressive but reactive, like nervous system response from the amount of stress that I've been under because I'm not cured yet, because I don't have a team of doctors that want to help me yet, because I'm sitting here while these granulomas are growing and no one wants to help me. My mental health was shot probably the entire month of April, to be honest with you, because I was just so frustrated trying to find someone to help me. And it feels like still no one wants to help me. Long story short, I'm not going to be getting surgery with that doctor, because it's like, if you have to make things so complicated, and if you can honestly look at someone who is in desperate need of help and still not create solutions and create more problems, and then tell me that you don't feel comfortable doing the surgery, the answer is obvious. You're not the one that should be working on me. Like, I, as a patient, cannot be so desperate to be like, oh yes, whatever doctor will accept me, please. No. I also have to be smart and say, well, you know what? I'm going to be waiting regardless of who I go with, regardless of whether I go with the guy that I have to pay out of pocket, regardless of whether I go with the best surgeon in the world. I'm going to have to wait, and these things are going to be growing in my body while I wait regardless. So I might as well go with someone who feels confident and willing and able to want to help me. So that's my new mindset around this. I took my time to feel sick. I took my time to cry. I kind of had to pick up the pieces a little bit. And, here I am now talking about it. I will say that one of the things that helped me most in finding some solution was me posting a TikTok about how frustrated I was, and I was crying on the video and cussing, and I was visibly angry. And another girl who has Mycobacterium, who lives in Florida, about like 30, 45 minutes away, actually has a infectious disease doctor, because she has Mycobacterium too. But she has an infectious disease doctor in Fort Lauderdale. And her infectious disease doctor agreed to see me within a week. Would you look at that? So I schedule an appointment with him. Mind you, it's not easy for me to get to Fort Lauderdale. Like, getting there was like $60 and getting back was $70. So that's already like $130 in transportation alone just for me to go to a doctor's appointment. I don't have a car. I was hit by a drunk driver. It's this long story. So I go to Fort Lauderdale. I see this doctor. His name is Dr. Stephen Renee. I will say his name because I have had a positive experience with him. And he, took his time with me. Like, that's the biggest thing. Like, take your time, listen to the history, ask your questions. He's doing everything right. And then, this guy agrees with me and my body on everything that I'm saying about the fact that, look, the antibiotics aren't penetrating, the antibiotics aren't working. Why suffer on antibiotics that make my ears hurt, that make my ears ring, that make me vomit, that give me stomach aches and knock me out and make me tired so I don't have productive good days? Like, why suffer more on antibiotics when they're clearly really not doing anything? And he was like, yeah, and we don't even know if they're actually working. So come off the medications right now, because I don't want you to suffer more than you already have, and I need your pathology results. And so he starts getting his assistant in there, the assistant's getting fax numbers, and then he's picking up his phone. He's calling his 2 surgeon friends. He's like, hey, I have this girl. She has Mycobacterium. I need to know if you can operate on her. Do you accept this insurance? Da-da-da-da-da. Boom. The first surgeon he called didn't accept my insurance. The second surgeon he called accepts my insurance. And then I have a consultation with that surgeon in 20 days. So am I happy about 20 days? No, but maybe there is a cancellation and I can, come in sooner. But the fact that an infectious disease doctor did all that in my 1 hour appointment slot speaks volumes. It's like, I don't understand why I couldn't be getting this treatment all along. He, was in front of me speaking with this doctor on the phone, letting him know like, hey, this is a Mycobacterium case. Hey, these are granulomas. Is this something that you would take on? So that I don't have to wait an entire month for me to get to a consultation just for a surgeon to tell me, no, I'm not going to operate on granulomas Mycobacterium. Like, that's what I've been dealing with. And it's like, it's just such a bullshit. And I will say, like, the number one thing that I look for now in a doctor is like initial initiative. Like, I want to see you have initiative from the second that you hear my background, from the second that you hear that I've been fighting Mycobacterium for 3 years and that this has ruined a young girl's life and taken away, you know, my young 20s from me. I want to see not only you express empathy, but I want to see the solutions running through your head. Like, okay, what can we first do to help this girl? Who do I know that I can connect her with? How can I possibly get her to a better day tomorrow? And that's the initiative that I want to see. And I think the issue that I realized is again, these hospital doctors, they're run really thin. They see so many people. Their schedules are back to back to back. They don't have the time. And it's like, I can't even blame them because I don't even have the mental bandwidth to do, you know, what I do. So imagine being in I'm just saying, like, mental bandwidth can be easily run down, and a lot of these doctors are run down, and that's why there's such long wait times, and that's why it's so hard for people to get help. And it breaks my heart that there's a lot of people out there who are not able to get help in an adequate amount of time, and I think it sucks for all of us, but you just have to keep calling and keep searching. And when I tell you, like, I have spent more hours probably calling and sitting on a hold and sitting on wait and getting transferred from department to department to department just to get a hold of these freaking hospital doctors, it's annoying. That's not to say that there aren't good doctors in the hospital. I know that there are good doctors in the hospital, but again, their wait times are far longer than the time that I can continue to give just to get a maybe, or just to get a consultation, or just to not have a guaranteed surgery scheduled in the books. I need these things removed as soon as possible. I'm going to go with the doctors that look like they actually give a damn about what I'm going through. So that's basically all the updates that I have regarding, you know, my health and the whole Mycobacterium situation. I will add that one thing that I appreciate about the infectious disease doctor, the one that helped me feel better, was, you know, he looked at me and he said, look, this is a hard thing to eradicate completely from the system. I agree with you that if we remove more tissue, the less chance there is that Mycobacterium will be able to respawn in any area of the body. We need to remove these granulomas, and we need a doctor who is able to remove them as they come up and do it quickly and effectively before they grow and spread, right? I love hearing that. Also, he was honest with me in saying that, okay, you've been fighting this for 3 years. You probably have a year or two left to go. I can accept that. Like, I would much rather a doctor tell me, like, hey, I'm not going to lie to you. You're probably going to be fighting this for the next 2 years at least, but we're going to figure out some solutions, and we're going to make it a lot easier, especially since you're on the mend, for us to get these, you know, granulomas more under control. I can accept that. Like, I'm not sad about the fact that I have a doctor telling me it's probably going to be a year or two more. It helps me set better expectations. Like, I can accept a doctor telling me, hey, there's still, you know, a year or two left of you fighting this, and visibly be able to see that this doctor cares about creating solutions. What I don't want to hear is like the I don't know, and I don't have any solutions for you, and I can't come up with anything right now. Like, I don't know what's going to happen. Like, it's like, okay, let's not think of like negative possibilities. Let's think of like positive solutions. Like, being negative about me still fighting this for another year or two potentially is literally not going to do anything. I know that was kind of a lot. I know I kind of rambled on. So for whoever cares about this, thank you. I appreciate you. And I will continue to do updates like this where I can go a little bit more in depth on what I'm experiencing on the back end of me fighting this. And then again, like, hey, apparently I have another year or two minimum of fighting this Mycobacterium. And I, you know, believe in miracles. It could be less. Maybe after I get these granulomas taken out, 0 more ever pop up again the rest of my life. Like, that would be the biggest blessing come true. Probably is not going to happen, but it's possible. I will be taking you guys with me for the days of my surgery. I'll actually be doing like vlogs in person for YouTube now. Yay! So I just want to let you guys know that, because I really do care to involve you in this process, especially for those of you guys who are watching me, who are fighting Mycobacterium or something similar yourself. We're in it together. You can always message me. Don't forget that I have that anonymous submission form in the link that I put down in the description. If you have a story that you'd like to share with me, I'm all ears. I will see you guys on the next episode. And if you haven't already, please don't forget to like this video, subscribe to my channel, and comment down below if you'd like to see something specific in my next videos.